in my current position as a clinical educator, if I were to apply for the next position or to be promoted, that would be the department chair of nursing. So, in my opinion, in order to be an effective leader, a leader needs to be present in order to be effective. And what I mean by that is engaging, actively listening to others, collaborating, taking visible actions in order to better the work environment and the present culture. When a leader is present or visible, he or she can quickly respond to a changing workplace. Professional ethics are important to follow, and for this reason, professionals should do everything they can to adhere to them. Often in the nursing department, we are managing the ethic of care because we're often managing student issues. And in these situations, we try to work towards what's best for the student, but at the same time, not jeopardizing the integrity of the program. As nurse educators, we are guided by the National League for Nursing, its ethical principles for nursing education. And they focus on core values of caring, integrity, diversity, and excellence. So that's what I would adhere to if I was the department chair, but I also adhere to it as now as a clinical educator. So an example would be that it's not very uncommon for nursing students to be struggling in what we have very rigorous curriculum, and these moments require honesty and an open conversation, adhering to excellent standards, but at the same time demonstrating care for the student, that we want what is best for him or her, and then being able to provide them with resources so they can be successful. In regards to virtual teaching and bringing that into the department and all the associated resources, I would first begin with having a conversation and collaborate with the faculty regarding virtual teaching. What classes would be appropriate, because not all nursing classes could be offered virtually, and who would like to teach virtually, because it's not for everyone. So I certainly want to be able to respect that. And then I would provide an assessment of current faculty skills for virtual teaching. It's important to know where people are at before moving forward. And if education is needed, I'd help them develop a plan on how to do that. We are very fortunate to be small, so I could work individually with faculty on the development of courses. We have a nursing education resource called Elsevier. It's really a leading provider. On their website, they have downloadable content for classes, webinars for students and faculty. And also what's very nice is they have pre-developed case studies, and that's really one of the best ways to learn. There was a journal article by a nursing professor, Anne Bergeron. In her research, she actually made a case for case studies in nursing education, so we frequently use them. And I've been fortunate to be teaching virtually for a period of time, so I could be valuable in that situation. There are many issues in higher education. And if you look at the website of Advocate, it lists 20 biggest challenges in higher education. It's impossible to tackle all of them. And so to make it manageable, I would only focus on a couple of them, because I certainly want to be successful and not become overwhelmed. And I think the biggest one right now is access and affordability. Because my frame of reference is nursing, I'm going to use that as an example. So often we are focused on students obtaining a bachelor's in science and nursing, and I've really become an advocate of looking at taking smaller steps. So an example would be a student becoming an LPN for before seeking a bachelor's or even an associate's. The LPN program is 1 year, financially manageable, not overwhelming or daunting in regards to the financial commitment of 4 years. Also, the curriculum is not as rigorous as a bachelor's of science in nursing, so this allows the student an opportunity to kind of test the waters and see what they can manage. And in a year, there'll be an LPN who can make $35 to $55 an hour. So having that opportunity to make that kind of salary and then get clinical experience at the same time, this then could afford the student an opportunity to bridge their education to a bachelor's and then pay cash for their courses instead of taking loans, but at the same time getting clinical experience. This may also help with some of the barriers and the anxiety that we see in clinical education. So I have been advocating actually for Plymouth State University to offer an LPN program. But the other advantage to this too is if students are not successful in the bachelor's program, they can kind of take a little detour to the LPN program and then come back into the bachelor's program afterwards. So it really does provide another option for students who are in the bachelor's program but just are not ready and find out a little bit later than sooner. So some key strategic goals to increase the effectiveness of the institution, financial and community responsibility. So nursing is often involved in the community. We can offer free screening for blood pressure, diabetes, or other diseases. And we could also develop programs to donate local food and clothing. There was an article written by Krista Schroeder and Georgia Nasavarich, I don't know if I'm pronouncing that right, but examined this approach and found that this experiential learning was beneficial for postgraduate and at the same time help students assess social determinants. So I would definitely advocate for incorporating that kind of learning within the curriculum. In regards to financial responsibility, being really methodical with each financial request to make sure it's rational and needed. Also trying to increase scholarship opportunities and becoming more involved in obtaining grants. And building community and individual engagement. So certain disciplines, especially in the allied health curriculum, could participate in these activities, the screening activities like the blood pressure. Another example is like physical therapy could participate in health screening and offer education. Both nursing and PT could offer a stretch exercise program for the local senior center. Something that I know is not offered now, but definitely could benefit. And getting seniors engaged and socially connected also could help with a lot of the loneliness and depression that they experience. Individual engagement, another thought is what we do now in nursing is have students on our committees. And there are some higher education institutions that have looked at having students on committees and the benefits. There was some studies done at Harvard, San Diego Community College, and Indiana University, and it showed that it provides networking opportunities. Students acquire leadership skills, and they really learn how to be a team member. Why is this the perfect job for me at this time? In my humble opinion, the department chair's main priority are the students. And that has been my focus my entire teaching career. And they really are my why as to why I teach, not the how and what. And this was really emphasized in the Simon Sinek YouTube video. And if you know your why, you can be more compelling and influential. Thank you.